War is an algorithm. We will show its price. A hospital costs $50 million to build. It takes 5 years. Destroying it takes 5 minutes and one missile costing $500,000. But the real cost is not the building. It is the 50 years of health lost by the population it would have served. This is the equation of medical catastrophe, and it compounds. Yemen provides the data. In 2015, before the Saudi-led coalition intervention, Yemen had 3,507 functioning health facilities according to World Health Organization records. By 2020, only 51% remained fully functional. 1,150 facilities destroyed, damaged, or closed. Each facility served an average population of 7,500. The math is simple. 13 million people lost primary health care access. The immediate costs are visible. According to UN estimates, Yemen faced the world's largest cholera outbreak in modern history. Over 2.5 million suspected cases from 2016 to 2021. Treatment cost per patient, $200–500. Total treatment expenditure, $500 million to $125 billion. This is money spent treating a preventable disease. The outbreak occurred because water treatment facilities were destroyed and hospitals could not provide basic sanitation. The missile that destroyed the water plant cost $2 million. The cholera epidemic it enabled cost 500 times more. But treatment costs are minor compared to productivity losses. According to economic impact studies, each cholera case results in average 15 days of lost work. 2.5 million cases, x 15 days, x $5 average daily wage, $187 million in immediate lost productivity. This assumes survival. Over 4,000 died. Average working years remaining, 30. Economic output lost, $6,000, $10,000 per person over lifetime. Total, $24 to $40 million in permanent GDP reduction from deaths alone. The cascade continues. Cholera survivors, especially children, suffer long-term health complications. Malnutrition rates in Yemen reached 2.2 million children by 2023, according to UNICEF. Malnourished children score 5 to 10 IQ points lower on average, per developmental economics research. Lower IQ correlates with 15 to 20% reduced lifetime earnings. For 2.2 million children, 2.2 million x $8,000 average lifetime earnings, x 15% reduction, a $2.64 billion in lost future economic output. From one cholera outbreak. From destroyed water infrastructure. They said precision strikes minimize civilian impact. They got precision destruction of medical infrastructure, creating generational health catastrophe. Syria demonstrates the personnel dimension. According to the Syrian American Medical Society, 9 to 30 doctors were killed between 2011–2020. Over 15,000 medical professionals fled the country. Approximately 70% of pre-war medical workforce. Training one doctor costs $250,000, $500,000 and requires 10 to 15 years. Syria lost $3.75, $7.5 billion in invested medical education. This cannot be replaced quickly. The replacement timeline is generational. Medical school takes 6 years. Residency takes 3 to 5 years. Specialization adds 2 to 4 years. From decision to become a doctor to practicing specialist, 11–15 years minimum. For Syria to rebuild its medical workforce to 2011 levels would require training 15,000 new doctors. At current capacity, with most medical schools damaged or destroyed, Syria can train perhaps 500 doctors annually. Full replacement timeline, 30 years. This assumes peace, funding, and students. None are guaranteed. During those 30 years, the population lacks adequate medical care. According to World Bank Health Economics data, inadequate health care reduces life expectancy by 5 to 10 years in conflict zones. Syria's pre-war life expectancy, 75 years. Current estimate, 65 to 68 years. For a population of 18 million, losing 7 years average life expectancy equals 126 million person-years lost. Valued at even $5,000 per year, low estimate, total economic value, $630 billion. This exceeds Syria's entire pre-war GDP of $60 billion by 10 times. The chronic disease burden multiplies costs. Wars create injuries requiring lifetime care. According to International Committee of the Red Cross data, Syria has over 86,000 amputees from the conflict. Lifetime medical costs per amputee, $100,000, $200,000 for prosthetics, rehabilitation, infection treatment, and psychological care. Total liability, $8.6 to $17.2 billion. Syria's entire health budget in 2010 was $1.2 billion annually. The amputee care burden alone exceeds 7 to 14 years of total pre-war health spending. But amputees are visible. The invisible costs are larger. Post-traumatic stress disorder affects an estimated 30 to 40% of conflict-exposed populations, according to psychiatric epidemiology studies. In Syria, with 13 million directly exposed to violence, this means 3.9 to 5.2 million PTSD cases. Treatment cost per patient over lifetime, $20,000, $50,000. Total treatment need, $78 to $260 billion. Syria has approximately 150 psychiatrists remaining for 18 million people. That is one psychiatrist per 120,000 people. International standard, 1 per 10,000. Syria would need 1,800 psychiatrists. Training them, 18 years minimum at current capacity. They said, wars end when fighting stops. They got medical consequences that compound for 50 years after the last shot is fired. Gaza reveals the cyclical trap. According to UN data, Gaza's health infrastructure has been destroyed and rebuilt 4 times since 2008. The 2014 conflict damaged or destroyed 17 hospitals and 56 primary care facilities. Reconstruction cost, $450 million. The 2021 conflict damaged the rebuilt facilities again. Reconstruction cost, $380 million. The 2023-2024 conflict destroyed approximately 70% of health infrastructure, according to WHO assessments. Reconstruction estimate, $1.2 billion. Total reconstruction spending 2008-2024, over $2 billion. But this is not $2 billion of healthcare improvement. It is $2 billion to return repeatedly to inadequate baseline. The same facilities, rebuilt with same vulnerabilities, to be destroyed again. This is not investment. This is maintenance of permanent crisis. The opportunity cost is staggering. $2 billion in stable conditions could have built 40 modern hospitals with advanced equipment. It could have trained 4,000 additional doctors. It could have established comprehensive chronic disease management for 500,000 patients. Instead, it bought 4 cycles of rebuilding basic facilities to minimum function. Between destruction cycles, the population degrades. According to Palestinian Health Ministry data, chronic disease rates in Gaza increased 300% from 2008-2023. Diabetes prevalence, 15.3% of adults, double the 2008 rate. Hypertension, 25% of adults. Cancer treatment capacity, effectively zero after 2023 bombardment. Patients requiring cancer treatment, estimated 4,500 annually. Without treatment, mortality rate approaches 100% for aggressive cancers. 5-year survival rate with treatment, 60–70%. Gaza's destroyed medical infrastructure condemns approximately 2,700 cancer patients annually who would survive with treatment. Life years lost per patient, 20–30 years average. Annual loss, 54,000, 81,000 person years. Economic value at $5,000 per year, $270, $405 million annually. This is one disease. one consequence of destroyed healthcare. The pharmaceutical supply chain reveals another dimension. According to Médecins Sans Frontières reports, essential medication stockpiles in conflict zones deplete within weeks when supply chains break. Yemen ran out of insulin in multiple governorates in 2016-2017. Diabetic patients without insulin. Death within days to weeks for type 1, severe complications for type 2. Estimated diabetic population in Yemen, 1.2 million. Insulin supply interruption affected approximately 400,000 patients, according to aid agency estimates. Deaths directly attributable. Unknown, but likely thousands. Long-term complications from interrupted treatment, kidney failure, blindness, amputations. Treatment costs for these complications, $50,000 to $200,000 per patient over lifetime. The medical waste creates environmental health hazards. Destroyed hospitals release asbestos, medical waste, pharmaceutical contamination. According to environmental health studies from Iraq, hospital bombing sites show toxic contamination persisting 10 to 20 years. Cleanup cost per site, $5 or $15 million. Iraq has over 200 damaged hospital sites from 2003-2017 conflicts. Total cleanup liability, $1 to $3 billion. This is separate from reconstruction. This is just removing toxic rubble. Vaccination programs collapse in conflict. According to WHO data, Syria's childhood vaccination rates dropped from 91% in 2010 to 52% in 2016. Diseases previously eliminated returned. Polio reappeared in 2013, first cases in 14 years. Measles outbreaks multiplied. The economic cost of vaccine-preventable disease is well documented. Every dollar spent on vaccination saves $44 in treatment and productivity costs. Syria's vaccination gap affected approximately 2 million children. Lost economic benefit, $2 million x $44 per full vaccination schedule. $88 million annually in additional disease burden. Compounded over 13 years, over $1 billion in preventable disease costs. They said, healthcare is civilian infrastructure protected by international law. They got healthcare systematically targeted because its destruction creates maximum population suffering at minimum cost to attacker. The reconstruction timeline exposes the trap. According to World Bank post-conflict reconstruction studies, healthcare systems require 15 to 25 years to return to pre-conflict functionality, even with substantial investment. This is not rebuilding buildings. Buildings take 2 to 5 years. This is reconstituting workforce, re-establishing supply chains, rebuilding trust, restoring standards. Ukraine provides current data. According to Ukrainian Ministry of Health, over 1,000 medical facilities sustained damage from 2022-2024. Estimated reconstruction cost, $15 to $20 billion. But cost is only part of the equation. Over 5,000 medical professionals emigrated in 2022 alone. These are trained specialists. Replacing them requires 10 to 15 years, even if medical education restarts immediately at full capacity. Meanwhile, the population ages. Chronic disease burden increases. The gap between medical need and medical capacity widens annually. The pandemic dimension multiplies everything. Destroyed healthcare systems cannot respond to epidemics. According to epidemiological modeling, conflict zones face 10 to 20 times higher risk of epidemic spread due to collapsed public health infrastructure. COVID-19 mortality in Yemen, likely 5 to 10 times higher than reported due to non-functional surveillance and treatment systems. Each epidemic further strains the degraded system, creating cascading failures. Mental health infrastructure faces worst degradation. According to global mental health assessments, conflict zones allocate 0.1 0.5% of health budgets to mental health versus 5 to 10% international standard. Afghanistan's entire mental health system in 2021, fewer than 50 psychiatrists for 40 million people. Treatment capacity, approximately 10,000 patients annually. Estimated need, 12–15 million people requiring some mental health intervention. The gap is not closable within any reasonable timeline. The final calculation is generational. A child born in Yemen in 2015 is now 9 years old. They have lived their entire life in medical catastrophe. Malnutrition stunted their growth. Preventable diseases damaged their development. Lack of health care for mother during pregnancy increased complications. Missing vaccinations left them vulnerable. Psychological trauma from violence requires treatment they will never receive. This child will enter the workforce around 2030. They will be less healthy, less educated, less productive than they would have been without war. Their lifetime earnings will be 30 to 50% lower, according to developmental economics research. Multiply by 5 million children in Yemen affected. 5 million x $20,000 reduced lifetime earnings. $100 billion in lost human capital. This is larger than Yemen's total GDP. And this child will have children. Malnourished mothers have higher rates of low birth weight babies. Low birth weight correlates with lifelong health problems and cognitive deficits. The damage transmits generationally. The medical catastrophe of 2015 will still be producing economic costs in 2070. This is the algorithm. Destroy medical infrastructure. Population health degrades immediately. Treatment costs explode. Chronic disease burden increases. Workforce productivity declines. Human capital deteriorates. Economic growth stagnates. Tax base shrinks. Government cannot fund healthcare reconstruction. The system cannot recover without investment. Investment cannot occur without growth. Growth cannot happen with degraded human capital. The loop closes. We counted the destroyed hospitals. We did not count the destroyed lives those hospitals would have saved over 50 years. We did not count the children who will die from preventable diseases. We did not count the amputees who will need care for 40 years. We did not count the PTSD patients who will never be treated. We did not count the reduced life expectancy multiplied across entire populations. The missile costs $500,000. A hospital costs $50 million. The destroyed health of a nation? Incalculable.